My name's Tim Gibson. Thomas Boerger is very meticulous and very knowledgeable in what he does. I have absolutely no qualms about going to Thomas for any of ligament or tendon type injuries. He's also, as I've found out, the resident expert in the area for knees and ligaments and tendons and those sorts of surgeries, so it's pretty much a no-brainer. I've had 3 procedures from Thomas. One was a Achilles tendon reconstruction and twice on my ACL. As a passion, ride hard enduro motorcycle, and having an injury like an ACL becomes very it effectively stops you riding at a certain level because you can't take the forces from that sort of riding. So when I broke my Achilles tendon, which was the first surgery that I went to Thomas for, you've obviously got no movement, you can't run, you can't play sports, you can't walk, you can't ride. So in that situation, it's not a decision, you need to have it repaired. And I came across Thomas through a referral from the family GP that I was using at the time, and Thomas from day one came in, diagnosed it, instantly said this is what we need to do. And then obviously subsequent injuries, already knowing Thomas's surgery and personal skills, it was a lot easier to go straight back to Thomas rather than to fish around. Process goes through the various stages, so there's the primary contact either through your referral from the doctor, or in my instance I can contact them directly and say, look, I've had this problem, I think I might have done X. The initial consultation is pretty much just talking and deciding whether you're needing a MRI, whether you need X-ray, and the initial diagnosis. Sometimes, for example, on the Achilles tendon, you can tell without having any other investigative or diagnostic methods. So the ACL is slightly more difficult, obviously, because you can't see it. You can do certain tests which tell you, and then usually the second component is to have an MRI to confirm the diagnosis. That's one of the biggest draw cards for me with Thomas is, so for example, I would ask him about what the new methods are, or whether there's anything which is slightly left of centre in terms of surgery for repair of that particular injury. And while Thomas knows of all of the new developments, he's very much focused on the one that really works, not the one that's fairly exploratory. He's very good in the sense of taking the time to explain the details of the injury. So each time I've been to Thomas, I've wanted to know more about the extent of the injury, the extent of the impact on motion, and the rehabilitation process required, not from a point of view of physical rehabilitation, but the actual injury itself. How long does a ligament take to heal? What happens during that process? And he's always very happy to explain to a level of detail, which is great. So the procedures were all done at High Care down in Puerto Banús. The way the procedure goes on the day is that you come in the morning, 10:30 or so. Usually the surgery will be scheduled for 11:30, or roughly an hour after you get there. In High Care, High Care is like a resort more than a hospital. You have your own private room. It's a very low-key environment. The staff are all fairly efficient in, if the surgery is booked for 11:30, you're processed by the various different people in the hospital, and you get into the surgery room usually on time. You're usually given an option of whether you want a full GA or whether you want epidural, or there is alternatives as well. If you're out for the whole process, the next thing you wake up back in your room. There's usually an hour or two of recovery, and then Thomas will finish the other surgeries that he's got for that day. He'll come in, check on you, advise you on when you can leave, and whether there's anything that you need to do in the interim. He also deals with if you need crutches or if you need a brace or any of those other medical implements to get through the period. So yeah, it's a Thomas's service is very comprehensive in that sense that you're not left wanting something. You're booked in for 24 hours, so you've got the room for 24 hours, but to my surprise, on the first time, Thomas came in 2 hours after the surgery and said, well look, to all intents you can leave tonight. There's nothing stopping you walking on that knee. I had assumed that you needed a crutch or a brace, or anything. He said no. So long as you're physically prepared pre-surgery, you've got the advantage of your muscles already been developed, you can still walk, you've got the stability. So yeah, it's not a long term, it's as fast as you can get out and start rehabbing. It's interesting. I think the main component there is where you do an injury which has the potential to be very debilitating over time. Your choices are to either accept a degree of inability or debilitation or fix it. As part of the rehabilitation process, I've spent a lot more time focusing on corrective exercise and preventative exercise. So when I did the Achilles tendon, I think there was largely a component of pushing myself beyond what my body was capable of at that time. So you increase the force on a particular tendon or joint that goes. With the ACL was the culmination of a period of pushing myself beyond the limits without the fitness to back that up, and that results in an injury. And at that point your choice is either fix it properly or not. So the impact of both injuries in a cumulative sense was that kicked me out, it kicked me off the seat to go and make sure that my fitness levels and my core strength was sufficient to start to be able to act in a preventative way against further injury. The second injury to my ACL was not the product of fitness nor skill. It was purely just unfortunate circumstance, which I don't think even if I had had a fresh ACL and been super fit, I would have been able to prevent. So, I've not, at no point has it become debilitating. So, yes, I've had the repairs done. If anything, I've had a greater degree of functionality out of the repair after the surgery than I had pre-surgery, and I've not suffered any effects in terms of ongoing pain nor lack of confidence on the joint, nor any decrease in pre and post surgery exercise levels. If anything, I do more exercise and harder exercise and ride at a higher level now than I ever did prior to the surgeries, and that's very much just a psychological component of how you deal with these sorts of injuries. His knowledge, while his specialty is hips and knees, he also has breadth of knowledge. He's also very respectful of the person that he's dealing with. So one of the key things for me was Thomas wanting to, on the second repair to my ACL, wanting to make sure that he had, after COVID, he'd had time to just refamiliarize himself with surgery, because for me, it's critical that I have a problem-free repair, that my repair is as good as it can be, because I'm going to pressure it and I'm going to use it heavily, and if I suffer problems, then that causes a major decrease in the quality of life for me, or the sort of exercise I can do. So he's also his methods will change over time. So the first ACL surgery, the components that he used during the surgery were slightly different to the second one, which is indicative of continuing to update his techniques according to what he believes is the best way to carry it out at the time and the technologies available to him. In addition, I think one of the other very important things about Thomas is the adaptation during the surgery. So prior to the second ACL repair, we had talked about an additional component of surgery to try and stabilize the knee a little bit more. However, as he said after the surgery, when he got in there and performed the test on the knee was stable enough not to warrant doing that surgery, and so that surgery would have been superfluous. It just would have been an additional injury or an additional component to have to recover from. So he's very much adaptive in the process, even while in the midst of surgery, and making a call on whether it's absolutely necessary to do that or not.